Are you already on Vikisana?
Dear viewers, a warm welcome to our today's format, Visite. I am always looking forward to this program, especially since I have already met many of you. For me, this is not a speech into the void, but a very beautiful, intense interaction, because I know how valuable this program is, how we all shape it together, and how beautiful it is that many things in consciousness can change. That's all it is. Staying healthy is a question of my own individual decisions. I am an adult, I can decide what I buy, how I live, how much I sleep. These are important things. If you understand that health is just as unstable as life itself, then I can do a lot for it to become stronger and stronger, so that even in big situations I can remain stable and not be attacked. Today I received a letter from Hannelore, and I thank her very much. Hannelore, you write that you are 65 years old. You keep watching these many interesting programs, and you were able to learn a lot from the post. Cholesterol is cool. In January this year, your family doctor, which internist, advised you to get a 6-month blood test, and your cholesterol was too high. The lipoprotein was measured for the first time and was also too high. You were also doing very well at that time. You write that you have been taking care of your dear husband for 8 years. Your husband is in care level 4. It was a very tense time, and I felt restless, unconcentrated, and exhausted. The family doctor then referred you to the cardiologist, who did various examinations in the ER, and carried out a long-term blood pressure measurement. The blood pressure peaks naturally resulted from the situation for your husband to be there. The blood pressure tablets were then rejected and you checked the blood pressure yourself. You tried to integrate breaks into your everyday life, to carry out progressive muscle relaxation. And now you tend to be a little higher again and again, but no longer in rest phases at all, and above all, the values have slowly adapted to a normal range. Wonderful how you handle that. I feel like a healthy woman now and I don't take any medication to this day and I actually don't have any pre-diseases. So far, my body has been able to regulate everything itself. That's what you put it beautifully. That's the way it is. You then contacted a metabolism specialist, who immediately presented you with a nephrologist in the form of this increased cholesterol level, and he immediately prescribed avestotin. Because the lipoprotein value is genetically dependent, and it is now important for him to lower the LDL. Because he is already beginning to have a slight arteriosclerosis in the neck. Unfortunately, the general practitioner and also the neurologist only view the whole thing symptomatically, and not at all in the context of my individual situation as a whole person. I don't want to take the statins with the many side effects, because I feel healthy. Why should I actually burden my body with it and deliberately bring it out of its balance? Once a year I go to the cardiologist. I don't smoke, I don't drink alcohol, I have enough exercise with the house and garden, and 4 times a week my husband is now in a daycare, which means I can handle it all very well with each other. Sometimes I'm at my limit and need a break, in which my husband is of course now in the short-term care. I take vitamin D3, Q10. Since then I feel stronger and more balanced. I don't have a good gut feeling to take a statin. My husband is an example of this claim not always being true. He took statins for years and got 3 pipers in the heart and a severe stroke a few years later. I would be very grateful if you could help me in my decision. How I can protect myself from severe diseases without bringing my body too much out of balance. Thank you very much for your important contributions, which I understand very well and can appreciate. I wish you and so on. And then, dear Hannelore, you sent me your laboratory values. If you want to make a statement about a total metabolism, that's maybe 5%. Nevertheless, these are simply the classics, which we then also look at medically, which give you a snapshot and which of course also justify the next step to change or respond with a drug. And I think it's very nice that I increasingly feel that you can't take everything immediately as given. And maybe also slowly register to what extent we, as doctors, mainly deal with the cosmetics of the laboratory, and look less at the overall situation. Therefore, first of all, respect and appreciation for what is going on in your mind. And you are from Gustro. I am always happy to read about people from the north of my homeland. And I would now like to share a few thoughts with you. I have been a doctor for 30 years and I have, I believe, prescribed 2 times 1 statin witting the thousands of patients I had. There is one indication that I simply have to say, with a severe genetic metabolism, you can see when you take the blood. That it is already so cloudy and bright, because a lot of the cholesterol is released. These are genetic questions, which then have to be diagnosed really hard with a family defect. And at 95 or 99.5%, it is also so, based on an increased cholesterol, it is not justified at all. You are doing the right thing. The second indication is that recently, of course, we have a lot of high-quality coagulation disorders in the context of post-vaccine syndromes. I have never felt so humiliated as a doctor in my life, as in these years. To see what has now become a tough reality for people in the context of the chronic 2-protein load. We are really facing high coagulation problems here, which, in the context of a newer observation, through the treatment of anticoagulant agents, such as marcoma and heparin, which can also be treated with natapinase or serrapeptase. But here, in a peculiar way, sometimes statins turn out to be highly anti-inflammatory. These are the latest observations, which I do not want to generalize in any way and which are a new observation for me. These are questions on which we were not medically prepared and still are not, because we dramatically sweep them off the table, that this has nothing to do with this event in any way. But we have to realize that we really have to get on our feet and extend our diagnosis far, far. A simple cholesterol, a few other values, then we have to take care of completely different values in humans. But back to you, please. The cholesterol here is also slightly increased, and you now know that cholesterol is the starting material of all hormones. This means that a too low vitamin D will always lead to an increased cholesterol, because the body, of course, as a hormone, and it has to form itself, the hormone needs to give more cholesterol to the system to produce vitamin D from it. In the context, in connection with UV light. A patient who takes care of a husband with level 4 care takes care of him 24 hours. That is, this problem to get into the sun has certainly came up short in recent years. The other thing is that cholesterol is the starting point for all cell structures of the cell substance in the context of the structure of an intact cell membrane. The liver will very well register that a cholesterol supply is necessary here and will produce more cholesterol in this regard. The second or the third would be, please do an examination of your stress hormone potential. You say you feel good, you are a healthy woman, but you would also admit that you may not have been able to handle your reserves so carefully in recent years as you would have liked. And a deficiency of DHEA, that is, the dehydroepiandrosterone, sacrifices the adrenals first. DHEA is formed in the adrenals. It is one of the most important stress hormones, in addition to adrenaline and cortisol. But it is also the origin of testosterone and estradiol. DHEA and saliva in the morning and in the evening can make a significant difference here. Please also take the active hormones with you, such as progesterone, estrogen, and also progesterone and testosterone. Yes, that is important. If you measure LDL quantitatively, a value of less than 3 is specified here. LDL is only a transport form, an atherosclerosis in the sense of protection. Who would like to protect themselves from an atherosclerosis is advised to examine the oxidized LDL. Because then we see the toxic form of LDL, which is of course caused by oxidation. That is, if free radicals oxidize this LDL and the antioxidant is not sufficiently available, then you really have to worry about it. But it does not go in the direction of statins, but of course that also has the task to ensure sufficient antioxidation here. By the way, homocysteine is an important parameter to decide whether an atherosclerosis will burden the body tomorrow. The homocysteine must be measured sober. We already talked about this in the earlier program. And if homocysteine is too high, then you really have to make sure that your vitamin B12, your vitamin B6, and also your folic acid metabolism are balanced. I can well imagine that. An immense amount of screws were used at this point. And if the homocysteine develops as a toxic substance then biochemically, then you should also be concerned. Substantially or also by the strict control of what is every day, what you take with you. whether this is really balanced. Please measure vitamin B12 as methylmalonic acid in urine. Then you know exactly whether B12 also arrives intracellularly. I would measure Q10. You say you take Q10. I know that's good. But it is even better to know this level and then to set it up optimally therapeutically. I just see that the need in such a burdening phase, which you are currently going through, is also given. I think it's very nice that you pointed out in your email that your husband is the best example. We see a surge among the statins in the rise of dementia, i.e. brain. Brain health already has the power to suffer from it. And I wish we would deal with all these things with more responsibility and take care of the causes of the actual things. Then we could keep people away from these decision-making paths. One more note when I look at your laboratory. Is zinc measured in the serum? Zinc is the trace element of the cell. Over 400 enzymes are zinc-dependent. That means unbelievable biochemical reactions cannot take place there. Zinc is the multi-talent of the cell. Please measure it in full blood, because 70% of zinc is intracellular. And please don't use it in the serum at all, because there is only 30% zinc. But the cell needs zinc, especially in the form of its intracellular immunity. And zinc is involved in incredible regeneration processes, including in the metabolism of cholesterol. That means there, too. If there is not enough zinc, it cannot be metabolized. Or vitamin B3. Vitamin B3 is a nicotine acid, which inevitably, when you add vitamin B3, changes the lipoprotein, lowers the HP, increases HDL, the good cholesterol in the people's mouth. I don't really use it, because I don't know whether it is good or bad. You really shouldn't do that, because nature itself has no need for good and evil. Especially since everything makes a lot of sense somewhere. To understand the big picture. And to understand why certain regulators don't work, why something here loses its balance. Shows us what to do. And you will really be very relieved when you go to another blood test, which will then also provide your doctor with something balancing. Where there is no need to take a cholesterol reducer. There is also the good mother's liver, which is mainly involved to regulate the fat metabolism due to bitter substances or also through quinoa, the artichoke. Or red rice. There are so many wonderful additional things, but you don't have to go that far. I think you are already on an incredibly good path. If you don't take a statin, or something really bad happens, go through it mentally or send it to me now. I really like to burden myself with all these things. Because at the moment I am very privileged not to be burdened, and then I can take it upon myself and I find it a ritual to let these things go. And you must not forget that in burdening situations, in stressful situations, and in situations where it sometimes goes to the extent of the possible and yet the body continues, you have to be careful. And you are now trying to organize this very well for yourself and maybe also share the burden and let go of it and get help here. To know your husband well and faithfully in the short term. That's all so well and in order. I hope, Hannelore, I was able to help you a little bit here. I might have a few more minutes. In the meantime, let me address another problem that has nothing to do with the last topic, but what we not very often, it's not true, but what you may sometimes judge in everyday life are people with incredibly large, tight legs, which are called elephantiasis. And if you have such an elephantiasis, then it is a really big and very, very serious disease. Sometimes you can't prove anything anymore, but this elephantiasis has developed in me. And I want to make you a little sensitive about how important it is that you can also develop diseases over a long period of time, which have already shown themselves in advance. And this fact moved me because it was a patient that we took care of. And again this cough, which was something of a torture during the day. And then it was the pulmonologist who said, "Do you perhaps also have an air conditioner in the office? Would you like me to give you early retirement? Would you prefer to get out of your everyday work?" No, I don't really want to. Everything is fine so far. And this cough actually became more and more unbearable. And why am I telling you this? I'm telling you this because the patient no longer has a cough. And because sometimes there are things behind it that you may not even include. It would be nice. I have to do a show about coughs. And just not being able to see anything on the lungs does not mean for a long time that everything is fine. And of course the lungs are also in a very big context with our digestion. But here with the so-called elephantiasis, it is a so-called filaria. The filariasis, which goes back to these, they are almost like little threadworms. Actually, these filariae are at home all over the world, and they are transmitted by night-active mosquitoes. You know the Anopheles mosquito, which can also transmit malaria. But there are also Ardens mosquitoes. There are different ones. But the Filaria mangrovi is a mosquito that has spread over time in East Asia and also in the Pacific. In India, too, almost 65% of these people, who are active during the day, are affected. The filariae are from 4.5 to 10 centimeters long, and they are only 100 microns in diameter, i.e., almost barely visible. But, as I said, the larvae can then be transmitted. The infection mode is then simply the sting. The larvae within 24 hours will then reach the regional lymph nodes and stay there until they are fully grown. First for 1 to 2 years, and then they will grow into adult worms. The course of the disease is 10 to 15 years. And now comes the point where I tell you or report about the patient with the cough. The interesting thing is these microfilaria. That only at night, between 23 and 24 o'clock in the blood, in the circulatory system, in the periphery, sometimes also in the afternoon. But during the day they are in the capillaries of the lungs. That's where they stop. In other words, a symptom, whatever it is, takes 3 to 16 months. And the picture of the disease is later called, as I said, elephantia. It is a severe lymphatic disease. Infectious. Allergic. And these proteins from the deceased micro or also macrofilaria make in the beginning a kind of dullness, and again fever, and then again not, they cause headaches. It can go up to encephalitis, to a brain inflammation, but also through the lymph node swellings, if you observe lymph nodes. And paresthesia. And in the later phase, over the years, there are cell-reactive or reactionary cell proliferation, so the whole tissue around the lymph node and within the lymph nodes becomes a mass of tissue. It's not that easy to find these filaries in the blood. But if you would have it examined on filaries, then you should do it at night, 23 to 24 o'clock, because you could still prove these filaries. In the first time. Otherwise, we work with the electroacupuncture from volume 50, and also with the salvia treatment, which is a bioresonance device. And if we have the information about a filarial load, then we treat it with the corresponding ripening frequencies, but also with ivermectin, and with the adult filaries, then with albendazole and ivermectin. I just wanted to show you that it is important to think about such loads early on, and at the latest when you have settled down in these regions. It can only occur many years later, because the development processes are slowly taking place. We have a mixture of many things, which we can no longer structure so strongly regionally. But for me it was highly interesting that we treated the intestine with this patient, and of course we looked at many things, but I just wanted to make it clear to you that you should also be sensitive to such things. Because it is always, when it is so advanced, a great path of suffering that people go through, and which has developed, of course, and therefore it is a great appeal to recognize this very, very early on, to react immediately. We have to stop the development of this disease early on. As with many other things, we don't solve the problem with an even better therapy in the end. Every disease has its time. Some need weeks, months, years. We solve the problem best when we understand what it takes to develop at all. Parasites still have a huge shadow in medicine. They are not held responsible for so many diseases. I have to tell you honestly, only since we've been able to analyze them, examine them, and then treat them. I know how strong and large this extent is, including neurodegeneration, including tumor disease. That's why I felt the need to be free from this suffocating cough that I saw the patient again some time ago, who was so grateful. I thought, how nice that this concern, which I didn't even know existed, is now out of the world. Because these things can't develop like that anymore. Dear viewers, thank you very much for taking the time to be with us again. Thank you for making this program so valuable and livable together. I wish you a wonderful time. I look forward to your letters to Visite at QS24.tv. Whenever you like, advice, a help. I try to make it very general, because we learn from each other. Thank you for all the valuable information you've given me. I wish you all the best. Goodbye.